Tonight, another great Monday night. We've got a great topic lined up for you. We're going to be talking about gluten and liver disease, liver damage, but we're going to throw in a kind of a bonus talk for many of you. We're going to talk about the gallbladder as well, because the gallbladder and the liver are quite intrinsic organs, meaning the liver is part of the gallbladder, right? And secretion of bile is very important. A lot of people don't realize this is one of the most common surgeries in the United States, is having the gallbladder removed, oftentimes referred to as a cholecystectomy. And we're going to be talking about, can gluten contribute to these problems, and can these problems make a comeback? In essence, can we heal? Is the damage too far gone? Does it get too late to actually heal? So we're going to talk about those, but before we do, want to make sure we do a little bit of housekeeping. Number one, if you can hear me, go ahead and type in to your Facebook feed or your YouTube feed. Go ahead and type in the number 1. Let me know that you can hear me, that my mic is coming in loud and clear. We're testing a new mic tonight, and I want to make sure you can hear me. Number 2, let me know where you're from. So tell me where you're from in the world, and we'll go ahead and get started. I like to know where my audience is coming from. So I'm waiting on your comments. I'm waiting on your feedback. I'm not looking at my phone, ignoring you. That's what we do today in social engagement, right? You go out with your friends and everybody's got their phone up to their face. No, I'm not ignoring you guys, I promise. I'm just waiting for your commentary. So dial in, let me know where you're from, number 1. And number 2, let me know that you can hear me coming in loud and clear. Okay, and I'll wait for your commentary, and as I get comments piling through, we will get started here. So hopefully, yeah, it looks like I'm coming in loud and clear. All right, and hey, those of you who are new to this information, welcome to Pick Dr. Osborne's Brain, and those of you who are veterans of this information, thanks and welcome back. And remember, as always, part of our mission, remember the mission at drpeterosborne.com and the mission at glutenfreesociety.org is to reach 100 million chronically sick people. So I want you guys to help me take that mission on, and the only way I can do it is if you share this information with somebody who needs it. So if right now, if you know somebody with liver disease, if you know somebody who's had a gallbladder surgery or a cholecystectomy, if you know somebody who's struggling with an autoimmune hepatitis diagnosis, please share this information with them right now. Just share this to their feed, type their name into the feed below, and let's get the information into their hands so they can get benefit too. Again, I can't reach 100 million people without you guys, so thanks for your help. So again, tonight we're talking about gluten. Can it damage? Can it cause liver damage, and can it cause gallbladder damage? So let's talk about the answer, which is absolutely yes, it can. So, the obvious answer is yes. But why is the bigger question, because knowing that it can without knowing why can be somewhat of a fruitless piece of information. So what do we want to understand about how gluten can cause this damage? So there are a couple different mechanisms. Number 1 is nutritional deficit. One of the side effects of gluten sensitivity is malnourishment. So nutritional deficit or deficiency is one, and we'll talk about each one of these in turn. But then we also have, beyond nutritional deficit, we can have directly an autoimmune response to the organ itself. Meaning that gluten can induce an autoimmune response against the liver itself, creating an autoimmune response. And then there's another way that this can happen as well. And by the way, these have all been researched pretty well. These have all been studied pretty well, these mechanisms. So it's important that you understand what they are, because that's going to give you the tools that you need, right, to have an intelligent conversation, hopefully with your doctor, who's going to be more open-minded to this once you go in and talk to them. But the third is the inflammatory damage. And we'll just kind of say it like this: inflammatory toxic buildup. Because gluten can create an inflammatory damage that can lead to toxic buildup of byproducts as your body is trying to put out the fire, and those can actually create collateral damage to the organs themselves. So let's kind of go through each one in turn. Nutritional deficiencies. There are some really critical nutrients that are important for the function of the liver and the gallbladder. So if you're gluten sensitive and you've got nutritional deficit as a result of the damage gluten causes to your GI tract, to your pancreas, to your ability to basically absorb nutrients from the GI tract. One of the big ones that we can see here is vitamin B12. And so vitamin B12, a lot of people don't realize this, but vitamin B12 is necessary to produce a substance called choline. Now choline is a B vitamin-like substance that helps prevent fatty liver buildup. So it prevents fat from storing. We'll just say prevents fatty liver. It's shorter to write that. So B12 is necessary to make choline, which prevents fatty liver. Now understand that B12 is absorbed. You've got to have, there are a couple different mechanisms here at play. I'm going to draw that on the board for you as well. We're going to run out of room again. In the stomach, this is the stomach, we have cells lining the stomach. They're called parietal cells, and they secrete acid, and they secrete another substance called intrinsic factor. We'll abbreviate that with IF. That's intrinsic factor. Now what happens is gluten can actually damage these cells. Gluten can also cause an autoimmune reaction that leads to your immune system damaging these cells. So there's more ways than one for this to happen. As a matter of fact, if you suspect this, your doctor can run a test called a parietal cell antibody test and measure whether this is happening, whether or not your immune system is damaging your stomach cells that make acid and intrinsic factor. Why is that important? Because these two nutrients, or these two substances rather, they help you to bind vitamin B12. So they actually pick up vitamin B12 and they taxicab it down your small intestine, where it's then absorbed in the distal ileum, where it's absorbed, which is the latter part of your small intestine. It is absorbed into your bloodstream, and without these two substances, you don't absorb vitamin B12 very well. And if you don't have adequate vitamin B12, again, that comes back to choline, and choline helps prevent excessive fatty storage in the liver, so it helps to modulate fat metabolism in the liver. And if your choline levels are too low, you can actually develop a fatty liver because of that. And again, vitamin B12 is necessary to produce that choline. So we've got, again, one step, nutritional deficiency, creating a secondary deficiency, creating a fatty liver process, which is actually quite common. When we see people with fatty liver diagnoses in our office, this is almost, well, not always the case, but it is very, very commonly the case. When we actually start testing their B12 levels, we start testing their choline levels, we will see these issues popping up very, very frequently. So important that you understand that, because if you're struggling with a fatty liver and you've just been told, look, you're story time. So I've actually had patients come in and they were literally accused of being alcoholics because they had fatty liver disease, even though they didn't even drink. And the doctors didn't believe them, so they accused them of being alcoholics. Now, if that's happened to you and you're listening tonight, give me an angry face, right? Just hit the angry face right now. We can get angry about it. But the doctor accused them of being an alcoholic, or called them liars, because they had damage to their liver that was basically calculated on a blood test, even though the person was not an alcoholic. So we want to understand that many people actually get accused of lying about this, because alcohol is one of the things that can do this too. In certain medications, if you're on more than 3 or 4 medications, and those medications are all processed by the liver through the liver, you can overwhelm your liver with too many medications, and that can also create this issue. So again, it doesn't just have to be gluten. I want to be clear about that too. Gluten definitely can create it in these different ways that we've got here. Where did my number 3 go? It looks like, yeah, here it is. We just didn't put a number on it. Let's put a number on it and keep organized. Gluten can cause the problem through these 3 ways, but multiple medication use can cause this problem. Alcohol can certainly cause this problem. Other environmental chemicals like mold toxicity can cause this problem. Yeast overgrowth can cause this problem. So let's be clear, we're not trying to put gluten in the catch-all for the only reason that people can develop an autoimmune issue or an autoimmune disease, but it's of the liver. But it's very important that you understand that it's multifactorial. So you've got things that should be tested for. B12 deficiency, choline deficiency certainly are things that can be tested for. Other things that can affect the function from an absorptive standpoint, one of the things, remember I said over here that acid is affected? Well, this acid being low or being affected, so when the acid secreting cells of the stomach are being affected, that can create a B12 issue, that can create a protein issue. That can create a vitamin B2 issue. It can create a chromium issue. It can create a calcium and a magnesium issue. It can create an iron deficiency issue. So there's a lot of different nutrients that are acid dependent, meaning in order for your body to be able to properly absorb them, you have to have adequate acid production by the stomach, and if you don't, these are possible side effects of what can happen. Now, if we just take this small list of things and we look, okay, protein, why is that important? Because protein produces a substance called glutathione, which is what the liver uses to detoxify. So if you're not getting adequate protein absorption, and many people, especially with celiac disease, have protein absorption problems, and they start to waste, they actually start to experience muscle wasting. Their liver's not getting adequate protein to produce glutathione, which is, again, the master detoxifier. It's the predominant protein that helps the liver take out the trash. So if your glutathione levels are too low, you can run into some major issues. And that, again, in order to get glutathione, we got to get protein. There's actually 3 amino acids that make your glutathione. Methionine, glutamine is the other one, and cysteine is the third. So if you've heard those amino acids before, glutamine, methionine, and cysteine all together form the tripeptide, tri meaning 3, peptide meaning protein. This is a 3 amino acid sequence protein basically designed to help your liver detoxify. So you need adequate protein to be able to produce this. Otherwise, what ends up happening is you come back around to liver damage. Glutathione deficiency itself can create a liver damage issue. So again, protein. Then we have B2. One of the things that B2 does is it regenerates glutathione. So one of its functions is it serves as an indirect antioxidant. By kind of like, think of glutathione as a cell phone, think of vitamin B2 as the charger, right? And so when you take away the charger, the cell phone only has so much power and then it drains. Well, B2 is the connection between the cell phone and the wall outlet, right? So it recharges that glutathione. So without B2, you get deficiencies of glutathione. Chromium regulates blood sugar, one of its predominant functions, and when you have blood sugar fluctuations, that puts more stress and pressure on the liver. That excessive insulin and that excessive sugar can put, again, more stress and pressure on the liver. And then calcium and magnesium and iron, these are necessary for, well, magnesium is necessary for about 300 different functions, but some of those functions have to do with detoxification and the proper methylation, and those of you probably have heard of methylation is a form of detoxification. So again, it helps relieve the burden, or the burden that the liver has on detoxification. And then, of course, iron deficiency causes an anemia, which reduces oxygen capacity to the liver, and that in and of itself can lead to kind of the liver starving, right? Starving of oxygen, not being able to do what it needs to do its job. So let's see here. We've got lots of people chiming in. I'm throwing a ton of information at you relatively fast tonight because I want to get through a lot of stuff on this topic. So we've got Lori from Menlo Park, California, and Patricia from New Jersey, and Karis from the UK, and Lynn from South Australia, Melinda from my backyard, Austin, Texas, welcome. Peruz from California, Los Angeles, Donna from Katy, Texas, Palmdale, California, we got Luann, Ontario, Canada, we got Laura, and you guys are from everywhere. This is great. Okay. Let's see here. So, okay, I'm going to answer questions as they come. And so this is kind of your warning call. If you want me to answer your question tonight, get it typed in early, and I'll do my absolute best. Understand, we've had some hate mail from several of you. No, I'm just kidding. It's not really hate mail. But many of you get mad at me when I don't answer all the questions. Well, I just don't have time to get to all the questions. So, and that's not to say they're not good questions, but you can, if you're not getting them in typed in quick enough, I'm not going to be able to get to them. So if you've got really important question you want me to answer, and it pertains to this topic, that's the other caveat. We got to kind of keep it on topic here and make sure that you're typing those in now. So again, I just showed you, and again, we're just touching the surface. What I'm trying to teach you tonight is conceptual, not necessarily every single nutritional deficiency and every biochemical reaction that's going to play the role in how the liver functions. But I want to give you concept, okay, so that you can apply concept, because it's more important not that you understand every nuance of this biochemistry. I don't expect you all to memorize this, but what I do expect you all is to be able to go to your doctor and have an intelligent conversation about how this can create this, and the outcome can look like this. So why don't we at least start from the premise of testing for these things and testing for gluten sensitivity? And one of the questions that has already come in is, look, I've got liver problems and I suspect gluten sensitivity. How do I know whether or not I'm gluten sensitive? How do we know? We do genetic testing. It's the only way to really know, because the blood tests what? The blood tests are inaccurate. They can be fraught with false negatives, and oftentimes the blood tests are only specific if a person has late-stage celiac disease. So again, by the time you have 10 or 20 years of damage from gluten and the test finally comes back positive, you've got 20 years to recover. You've got 20 years of damage to try to recover from, and that, again, we don't want to wait that long. We want to get in early. We want to get on the ground floor. We want to get this information quick so that we can make this adjustment so that this never happens, right? So ultimately, that's why we want to know why. If this is happening, we want to know why this is happening. And if this is the reason, we certainly want to know the answer, and that's the way you get to that answer. So the next one is autoimmune responses. So there have been a number of different studies, a number of really wonderful studies that show that gluten, especially the studies, most of these studies that were done were actually done in patients with celiac disease. So what we found was this very, very high correlation between celiac disease creating or contributing to an autoimmune hepatitis disorder. Now, I've got somebody in the feed earlier, and I'll have to go back and look at it. Somebody asked me earlier, or no, it wasn't even a question, it was a comment. And I want to read it because I think it's super important to put this myth to bed. Somebody stated that it's too late for me, I have autoimmune hepatitis. And I just want to put clarity to that comment, which is no, it's never too late. It's not too late, even if you have autoimmune hepatitis, for the liver to heal. Remember that the liver is one of the quickest healers in the body. It's a very, very fast healer. And, the gut heals fast too. The liver and the gut are, again, hand in hand, they're probably the quickest of all of your tissues in terms of their capacity for healing. So I want to be very, very clear, and I'm going to put up in the feed here, I'm going to put up a video. This is just a story, because many of you are doubting Thomases, or many of your doctors may be doubting Thomases or naysayers, but it is possible to put autoimmune hepatitis into complete remission without the need for immune-depressing medications or immune-suppressing medications, without the need for chronic steroid use, and without going that mainstream route. That mainstream route actually can lead to a lot more liver stress and liver damage in the long run, and it doesn't lead to a resolution. It only leads to a symptomatic suppression of the inflammation that's occurring in the liver, and you don't necessarily want to go that way if you're trying to find out why the disease exists. Now, if you just want to put your head in the sand and not change your diet, you need to go back to your other doctor, and you need to be on the immune suppressants, and you need to be on the steroids and the other things that are going to be used to treat an autoimmune hepatitis. But if you really, really want to get to the why, this is the one question that you're going to want to ask, right? So autoimmune responses are notorious. The gluten is notorious for creating autoimmune responses, and autoimmune hepatitis is no exception to that rule. Then we have the inflammatory toxic buildup. So this is what happens after the damage. So we take years of gluten-induced damage, and that's, gluten itself can create damage in a number of different ways. For some people, there's an immunological response that leads to an inflammation, and then that inflammation damages other tissues. So again, we've actually studied gluten, and we know that gluten can damage any tissue in the human body. And so part of that damage actually comes from the location of the damage comes from the actual individual's unique response. And let me give you an analogy. If I gave 1,000 people aspirin, would they all have the same exact response to the aspirin? And the obvious answer to that question is no, they're not going to all have the exact same response. Same analogy, if I give 1,000 people, a glass of beer, are they all going to have the exact same response to that alcohol in the beer? And the answer is obviously no, right? If I gave 1,000 people a big rush or dose of sugar, are they all going to react exactly the same way to that big dose of sugar? And the answer is no. Everybody is unique, and their reactions to different things are going to be unique too. And this is one of the fundamental problems when people go to the doctor and they don't have celiac disease, and the doctor says, well, you don't have celiac disease, therefore you don't have to worry about gluten, is they're assuming that everybody with gluten sensitivity is going to have the exact same type of reaction. It makes no sense for them to make that assumption, but that's the assumption that gets made. Now, if you've had that happen to you, if you've gone to the doctor and they tested you for celiac disease and your tests were negative and they told you, oh, gluten's not your problem, go ahead and type a 3 in to the feed right now, and let's just kind of get a poll and see how many of you have had that happen. I just want to get a feel for how common that's happened in our audience tonight. Okay, let's see here. So the numbers are rolling in. The angry faces are rolling in too. Okay. All right. So lots of threes starting to come in to the feed. So yeah, I mean, this is a common thing. It happens. So again, the damage from gluten can be different. It can affect different people in different ways. And so for some people, gluten sensitivity causes damage in the intestines that gets the diagnosis as celiac disease. For some people, the damage is in the lower intestine, and the diagnosis can be Crohn's or ulcerative colitis. For some people, it can be irritable bowel syndrome. For some people, the damage can occur in the liver, and that's autoimmune hepatitis. For some people, the damage can occur to the gallbladder, and that can lead to cholecystitis, which oftentimes leads to the surgical removal of the gallbladder, creating a fat-soluble vitamin deficiency risk for the rest of a person's life. So we certainly want to know the why before we start yanking out organs and removing organs. For some people, the reaction occurs in the skin. There are diseases like dermatitis herpetiformis and vitiligo and eczema and psoriasis can be gluten manifestations of the skin. For some people, it affects their joints, and so we can get things like lupus and rheumatoid arthritis and dermatomyositis. So again, gluten can affect different people in different ways, and I don't want you to think in that way that a lot of doctors think, which is if it's not celiac disease, it's not a gluten problem. It's just such a piece of misinformation that so many people struggle with because their doctors aren't doing the right type of appropriate testing to get them the solid answer that they need in order to justify going gluten-free. If it's necessary to do, you've got to, obviously you've got to know if it's the right move. So that inflammatory toxic buildup comes from the years of misdiagnosis, of the wrong testing, of gluten creating an inflammatory response, and then the body trying to mop up that inflammatory response. The body is constantly working, it's constantly trying to adapt, right, from this. So your body makes every attempt it can to adapt and heal. That's what your body is designed to do. Adapt and heal, adapt and heal, adapt and heal. So if you're doing something wrong to it, your body tends to try to heal that damage. But in the process, it also tries to warn you. It also tries to tell you that's the symptom that you're experiencing. The pain or the inflammation that you experience, that's your body trying to tell you, don't do that anymore. Stop this possibly, because we're going to run out of our capacity to adapt and heal. Remember, your body can only adapt and heal until it can't. It's that point of fundamental breakdown. It's that point where the body can no longer adapt and heal. That's the point at which we start calling something a disease. It's when your body breaks down, and that's when most people end up at the doctor, right? Because they're broken down and they're in pain, or they have some type of set of syndromes or symptoms that puts them in such dire straits that they seek professional help, and then they get a diagnosis. And it's, again, the diagnosis is nothing more than their body's attempt at adapting and healing, and that this attempt is now failing. The body is now failing to do this, and organs are being damaged and tissues are being damaged to such an extent that the person can no longer adapt. So we don't want to get to that level. That's the level where 20 years of damage goes by, and now we have, for recovery, and a lot of people ask me this question, how long does it take to recover from autoimmunity? It takes 18 months to 3 years. And that's for chronic autoimmunity. That's for somebody who's had an autoimmune disease and they've really been struggling for a decade plus. But somebody who's just brand new, getting just an early onset diagnosis or getting that early onset identity, this adapt and heal process, if it's not completely shot, the recovery can be a little bit quicker. It doesn't necessarily take 18 months to feel better, but it takes 18 months to silence that overreactive immune system. So again, we don't want to make it to that point. That's the point where you have the most struggle. That's the point where you have the biggest problem. So let's see here. We've got some questions firing in here. Karlek is asking, is organic sprouted wheat a better alternative to regular bread? No, not if you're gluten sensitive. And the reason I answer that question, even though it's not a question about the liver, is because I get it all the time, and people are so confused because of the misinformation that's out there on the internet. If you are gluten sensitive, and again, how do we know if a person's gluten sensitive? We do genetic testing. So you don't know whether you're gluten sensitive unless you've had genetic testing done. First and foremost, get genetically tested. Second of all, if you're gluten sensitive truly, It doesn't matter whether you sprout the bread, whether the bread is organic, whether the bread was made in a special soil, under special circumstances with the perfect amount of rain and the right amount of happy leprechauns waving a magic wand over it, it's still going to have gluten. So there is no such thing as sprouted gluten-free bread. It's going to have gluten if it's a grain, and if you're gluten sensitive, it's going to be a problem for you. So the reason I answer that question is because so many people are so confused about that particular component. Okay, let's see what else we got here. Okay. So is the toxic buildup in the liver or the gallbladder or both? Okay, so the toxic buildup is in the body. It's not just in the liver, it's not just in the gallbladder. Remember, the toxic buildup is basically it's post-inflammation cleanup. So let's just say, for example, a person is affected by gluten in such a way that it creates joint inflammation. And so then the body has to send white blood cells and other types of chemicals to that area to do the cleanup, to do the mop up. And so that cleanup leads to the secretion of more immune types of chemicals, and then all that stuff it's circulating in the bloodstream, and the liver has to do all the cleanup work. So once the body goes in with targeted inflammation to break down the muscle and then to heal the muscle, that circulating inflammatory toxic buildup has to then be filtered by your liver, by your kidneys. Okay, so it happens. It's not, I don't want you to think of it as just in the liver or just in the gallbladder. This is a systemic issue, just like all health problems are. Liver disease is not just liver disease, and that's a fundamental part of the problem in the United States and in industrialized nations, is that doctors, most of them are really trained. They're trained to do this, right? They just, I can only see what's in front of me. I can't take off those side blinders and see the actual whole of the patient. I can only see that person has liver disease, therefore they need to go to a liver specialist. That person has GI disease, therefore they need to go to a GI specialist. This person over here, this person has a joint problem, therefore they need to go to an orthopedist. Look, the days of specialization, it's not that specialization can't be helpful, but the days of seeing a specialist, when a specialist is not viewing the person as a whole person and they're just saying, you are liver disease, right? That's basically what they're saying. Therefore, you get paradigm A. Paradigm A is steroids and immune suppressants for autoimmune liver disease. Paradigm B for non-alcoholic fatty liver disease is we're going to put you on anti-inflammatories and watch and wait. And then for somebody who's maybe an alcoholic, the paradigm is, okay, you need to quit drinking alcohol and then go away and come back and see me in 3 months, right? But they're not seeing the whole person. They're not asking the question, what's creating the liver damage? They're just simply saying, you have liver disease. And what does that mean? You have liver disease. Why do you have liver disease? Every week I write this on the board. Why is the question you want to get used to asking. Why do you have liver disease? Why is the gallbladder malfunctioning? Why do I have joint pain? Why is the organ malfunctioning? What is the reason? It is not, the reason is never because you lack a surgical procedure to remove the organ, and the reason is never because you lack a specific chemical to artificially manipulate your biochemistry to suppress your symptoms. That's not why you're sick. Those are just things that are going to cloud why you're sick in the long run. Now, some people would say, well, the drugs are important because they gave me quality of life. Well, I don't argue with that. Your quality of life, that's a decision you get to make based on who you are. I'm just simply saying, if you want to know why, masking with drugs is not going to improve your longevity, and it's not going to eliminate the disease itself. And if those of you who are listening who are really looking for a resolution, for the root cause, for the origin of the issue, you've got to dig deeper than just the external symptomatic biochemistry that so many doctors specialize in. So Deborah's asking, is genetic testing like a DNA test? Yeah, genetic testing is a DNA test. However, as I said last week, 23andMe does not do the proper type of genetic testing for gluten sensitivity. They only test for a certain few alleles for celiac disease, and it's not the same thing. Remember that everyone with celiac disease is gluten sensitive, but not everybody with gluten sensitivity will develop celiac disease. There are subtle differences in genetic testing, and you want to make sure you get the right type of genetic testing. And those of you who are curious about what that might look like, you can go and read more about it at glutenfreesociety.org. And you can click the link at the top. It reads genetic testing. Cody's asking, can you outgrow gluten? Not if you're gluten sensitive. It's genetic. It's not a disease. Gluten sensitivity is a state of genetics. It's not a disease. Tracy's asking, how can we lower amylase without no longer having a liver or large intestine? Tracy, I don't know anyone who doesn't have a liver and is alive. I mean, it's a vital organ that you can't live without. So maybe rephrase that question. I want to make sure I got it right. Can you outgrow celiac disease? No, you cannot outgrow celiac disease. You can cure celiac disease by changing your diet, but you cannot outgrow the fact that if you eat gluten, you're going to develop it. How do you know? Cody, I love your healthy skepticism. Cody asks, can you outgrow celiac disease? I said no. He says, how do you know? I like that. That means you're asking the next question, Cody. That's fabulous. How do I know you can't outgrow celiac disease? Because celiac disease is induced by food. And you don't outgrow what you put in your mouth. You can change your diet and you can move away from celiac disease and you can put it into remission, but you can't outgrow it, meaning it's not you're going to have it for a certain quantity of years and then all of a sudden you're a big boy now and it doesn't hurt you anymore. If you're gluten sensitive, you're gluten sensitive. So you can't outgrow a gluten sensitivity because it's not age associated, it's genetically associated, and you can't change your genes. You can change the expression of your genes, and the way you change the expression of your gluten genes is by avoiding gluten, and the way you activate those genes to produce inflammation that can lead to celiac disease is by exposing yourself to gluten. So again, you can't outgrow it. I hope that clarifies it for you, Cody. Can gluten cause a fatty liver? Yes, it can, Colleen. Gluten can absolutely cause a fatty liver. That's what happens here. Remember, I was talking earlier about nutritional deficiencies leading to B12 and choline deficit, which causes fatty liver problems. So again, gluten-induced malnutrition can absolutely cause a fatty liver. Okay. Let's see here. Beth, I forgot to ask the dermatologist or tell him I ate gluten for 4 years straight. We're trying to rule out reasons or allergies to eye areas. Itchy for the last 2 years. Should know better. Celiac core issue and a lot of things. Oh, I don't get the question there. I'm not quite sure about that question. Sorry. So Laurie is asking, I'm gluten sensitive. I get sporadic severe pain on my left side under my ribs. I don't know what makes it happen, but it's scary, and I'm wondering if it might have anything to do with gluten contamination, or if we eat out, or any other ideas. Yeah, I mean, it can. Again, there are a lot of things that can cause left flank pain or left under the ribs. You've got your spleen is there, and part of your stomach is there, and the top of some of your small intestines are there. So it's very possible you're getting a referral pain pattern from damage, inflammatory damage of those organs that potentially is gluten-induced, but it's also possible it could be other things. Again, going back and getting and getting confirmation as to whether or not you need to be gluten-free, the best way to do that is to have the proper testing done. Okay, let's see here. We got some questions coming in on both channels. So, I have low bile. Should I test for normal liver enzymes? Hetty's asking, I have low bile. Should I test for normal liver enzymes? I mean, I don't understand the question so much, Hetty. If you have low bile, what some people find very helpful is supplements to help. Like there are supplementals with ox bile. There are supplemental amylase and lipase that people can take to help improve their fat digestion. As far as testing for liver enzymes, you can always test for liver enzymes. There's two major ones that are on simple tests. One's called an ALT test, alanine aminotransferase, ALT, and the other is called AST, and then there's another one called alkaline phosphatase, or ALP. These can all, when they're elevated, can all mean that there's a problem with the liver. Now, another test that can sometimes be run that can show us problems with the liver is elevations in ferritin. We start seeing high levels of ferritin, looking at 350 plus ferritin levels, that can also indicate that there is a liver problem. So these are, if you're asking the question, hey, do I have gluten-induced liver damage? I'm gluten sensitive, but is my liver functioning well? These are some screening tests that doctors can run. Now, one of the other things that can be looked at is there's something that can happen on your fingernails called a splinter hemorrhage. And so what it is it looks like a little black splinter embedded in the fingernail. And what we'll see these oftentimes is in alcoholics. A lot of alcoholics have a lot of these little black lines in their fingernails. They're called, again, splinter hemorrhages. That can be a sign, an outward manifestation of liver damage. Some people will develop jaundice. Their skin will just be yellower in color. Some people will develop jaundice of the eyes. Their eyes, the whites of the eyes, will be a little bit more yellow. So those are all kind of things that can be looked for to help identify whether or not your liver is potentially malfunctioning. Now, another test, and I didn't write it on the board, I'll go ahead and put that up here since we're talking about tests, is there's bilirubin. But it's important, if you run bilirubin is a byproduct breakdown of red blood cells. So when red blood cells break down, one of the byproducts is bilirubin, and then the liver has to process that bilirubin and convert it into something called biliverdin. So you can get your bilirubin levels checked, but if you're going to do that, ask your doctor to run two parts to your bilirubin test. There's a direct bilirubin and then there's an indirect bilirubin. So you want to have them do the bilirubin total and then the direct and the indirect, because that's where you're going to identify whether it's a hemolytic anemia problem versus a liver problem. So again, those tests can all be very, very helpful. If you're wanting to know, okay, I need to go to the doctor, what are the things that I need to look for to have measured? Okay. Lily, so say I have my gallbladder removed, then cut out gluten, but still have liver damage and fat-soluble vitamin deficiency. What do I do? Well, that's a great question, Lily. If you've had your gallbladder removed, so this is for those of you who've had cholecystectomies, gallbladder removal surgeries, very common surgery. Well, what happens for a lot of people is they have acute pain, and it's usually in the right shoulder blade area, and they're having an acute gall attack, and they end up in the hospital, and before they know it, the doctors are telling them, we need to remove your gallbladder, and boom, 1, 2, 3, it's done. You can't get it back. You can't replace the organ, once it's been torn out. If your gallbladder's been removed, all hope is not lost, but you should understand that some of the biggest problems associated with having your gallbladder removed, and the biggest one is fat-soluble vitamin deficiencies. So what are the fat-soluble vitamins? The fat-soluble vitamins are vitamin A, D, E, and K. So A, D, E, and K. Then we also have omega-3 and omega-6 fatty acids. These are what we call the essential fatty acids. You have to eat them. And so if you don't have a gallbladder, it means that it doesn't mean you can't make bile. It doesn't mean you don't have bile. Your liver can still produce bile, but you don't have the muscular sac that secretes the bile into your small intestine effectively. So there can be a diminishment or an ineffectiveness of bile secretion into the intestines. And so that can lead to an increased risk for the deficiency of these fat-soluble nutrients. So you can get vitamin A, vitamin D, vitamin E, vitamin K, and omega fatty acid deficiencies. And generally, in my experience, and I've seen a lot of this, but 5 years or so is when these deficiencies really start to develop as a result of not having adequate bile secretion into the small intestine. So again, these can be tested for. You can ask your doctor to run and check these nutritional deficiencies. It's very simple to do. You just have to ask the question. So any of you out there that have a gallbladder surgery where you've had your gallbladder removed, this should be something you're doing on a biannual basis, twice a year, checking, do I have deficiencies of fat-soluble vitamins? And if so, appropriate supplementation needs to come next. The other thing that all of you should be aware of is that if you've had your gallbladder removed, you should be supporting your digestion of fat. Like, you should be supporting that because you're at a disadvantage with the surgical removal of the gland. So you want to have, what I recommend people do is start with a broad spectrum fat-focused digestive enzyme. We recommend something called Ultra Digest GB. And the GB is really for gallbladder support. It's to help people that don't have a gallbladder. So it just supports digestion of fat-soluble nutrients. And so it's something you take with your meals as a preventative right? So that you don't end up with these types of problems, because vitamin A deficiency can cause leaky gut. Vitamin D deficiency is a trigger for autoimmune disease. Vitamin D deficiency can cause insulin resistance. Vitamin D deficiency can also cause 19 forms of terminal cancer. Vitamin E deficiency causes your DNA to age at an accelerated pace. Vitamin K deficiency prevents blood clotting appropriately, and it also causes a reduction in bone storing calcium, so your bones become more brittle with a vitamin K deficiency. And then, of course, omega-3, omega-6, they regulate the inflammatory cascade. So not having these, people can tend toward a greater degree of inflammation. But remember, there are also subtypes of omega-3, EPA and DHA. And DHA is the type of fat that your brain needs in order to maintain the myelin sheath, in order to maintain quality brain health. DHA, actually, omega-3 DHA has been linked to Alzheimer's and cognitive decline and dementia, among other problems. So very, very important nutrients that you want to support. So if you've had your gallbladder removed, fundamentally you want to support that. But secondarily, you want to ask, why did you have it removed? You can't put it back in, so don't beat that dead horse. But what you can ask is, what's happening? What created that damage in the first place? Why did it happen? And that's really where you want to get clarity, because just removing the organ because it was damaged doesn't mean that what was doing the damage was removed too. And so what happens a lot of times is people have that organ damage, and then over time, if they get the organ removed, what ends up happening is that their body is just getting damaged somewhere else. The organ no longer bothers them because they had it removed, but now they're just receiving that damage in some other area of their body, and so the disease continues to progress, just in a different location. It's like real estate. It's all about location. Carol's asking my location. Carol, we're located in Sugar Land, Texas, and you can get more information if you want to email us at originshealthcare@gmail.com. Okay, so Cheryl's asking, can fatty liver caused by gluten also give high cholesterol? The answer is yes, it can. It can also lead to high triglycerides. And that's another lab test we could add to this list, is elevation in triglycerides can also be a symptom of liver damage. Okay, let's see here. My 14-year-old daughter is having her gallbladder out this week. It was 20%. Was she born with a low-functioning gallbladder? No one's born. Look, Michelle, I can't give you medical advice over a video stream, right? And that, don't take this as medical advice. But if that were my daughter, I think that I would start asking a different question. Once you remove the organ at 14, you can't ever get it back, and so she's going to have potential lifelong consequences. I would ask the bigger question: why is the gallbladder malfunctioning? Understand those ejection fraction tests that doctors run on the gallbladder, where they say it's at 20%. That's not that it's functioning at 20%. A normal ejection fraction on a gallbladder is about 27%, so it's not too terribly low. And so the next question is, why is it low? Why is that gallbladder not secreting? Why is it not actively pushing bile out? There are a number of different reasons why, and I'm glad you asked that question, because we can talk about some of those reasons too. For some people, gallbladder attacks come as a result, and this is a big one. Let's see here. So let's just draw us a line. Vitamin C deficiency is one of the big ones. You need vitamin C to properly form bile. So here's what happens. Bile is a liquid, right? It's a liquid substance that is stored in the gallbladder. But if bile is thick and too sludgy, too tarry, sometimes it can even precipitate and form stones, if you've heard of gallstones or bile stones. Without vitamin C, the bile becomes sludgy. It becomes too thick. And so what happens is the gallbladder, which is a muscular sac, has to work harder to get bile secreted, so the ejection fraction is lowered. So, whether they've maybe not tested her for vitamin C deficiency, it's a possibility. Now, one of the other things that can cause that is taurine deficiency. Taurine is an amino acid. So going back to what I said over here about protein, remember all proteins are basically different amino acids. You've got about 22 different amino acids that form all of the different proteins. So taurine, in order to absorb it, requires adequate stomach acid. And so the person who's got a gluten sensitivity, who's got acid damage or damage to the acid-producing cells of the gut, can get protein malnourishment through taurine, and that can create, again, a sluggish bile. It can create a thick or too adhesive bile flow, and that can lead to what people perceive to be as a gallbladder attack, where you get the pain. And sometimes the pain is on the front, sometimes it's stabbing and it's going all the way through into the right shoulder blade. Sometimes the pain just feels like it's over the stomach, right? But again, don't just say you have a bad gallbladder and have it removed. That's like one of the worst things that you can do. It's not like it's appendicitis where your appendix could burst and kill you. This is a gallbladder, right? And so have additional testing done. That would be what I would encourage you to do, is just have additional testing done where you can ask a bigger question, which again is, why is the gallbladder malfunctioning in a 14-year-old? In my experience, the gallbladder malfunctions in 14-year-olds because they eat a lot of sugar, they eat a lot of grain, and they don't really take all that great care of themselves from a diet perspective. And so they put more damage into their body, they put more stress and pressure on their gallbladder and liver, and as a result of that, they end up with problems. Okay, what can cause high ferritin in the liver? Lots of things. An infection can damage the liver. Going back to, hepatitis, the classic, you've got hepatitis A, B, and C. You've got classic types of infections that can create liver damage that can elevate the ferritin levels. Some people taking toxic overloads of iron can drive up ferritin. But those are the big ones. A lot of different things can damage the liver. I've seen people that were exposed to chronic chemicals, where some of those chemicals, again, if they have to be metabolized through the liver, they're going to affect the liver. And when the liver's damaged, it releases ferritin into the bloodstream. Ferritin is actually, it's the way we store iron for a rainy day. The liver stores ferritin so that if you ever become iron deficient, you have extra iron that the liver can push out into the circulation. So if the liver's taking on massive damage, we're going to see ferritin elevation. And so again, anything that can damage the liver, which predominantly it's, in my experience, it's food, it's chemicals, it's nutritional deficit that the liver can't regenerate, and beyond that, those are the big things, right? Food, chemicals, and nutritional deficit. So looking into those things as potential possibilities is a good first step. Is it dangerous to completely remove gluten if we're not celiac? No. That is one of the, I'm glad you asked that. That's one of the biggest myths. It's not dangerous at all to remove gluten. It's never been dangerous. The people that say that it's dangerous to remove gluten, what they're referring to, if you ever go and read those types of articles, and a lot of the nutritionists that talk about how a gluten-free diet is dangerous, avoiding grain isn't dangerous. Avoiding gluten isn't dangerous. What's dangerous is taking wheat, barley, and rye out of your diet and then going over to the grocery store, the gluten-free aisle, and buying all that processed garbage junk food that's full of genetically modified corn and sugar and rice, and they're calling those things gluten-free, and that person is now eating all their food from the gluten-free junk food aisle, and that's what's dangerous, because there's no fiber in it. It's highly low nutrient dense food, so it's very poor in terms of its overall nutrition deliverance to the body, but it also, those grains are not gluten-free. So again, those traditional articles that you read about, it's dangerous to go gluten-free because you're missing nutrients and you're missing fiber. No, you're not. Not if you're eating what you're supposed to eat when you're on a gluten-free diet, which is fresh meats and vegetables, lots of vegetables and fruit and nuts, like healthy, real, wholesome food, as opposed to boxed food. You can't take a sick person who's been eating boxed garbage and switch the type of boxed garbage that they're eating and expect that they're going to recover their health. So at any rate, I'm going to get off that horse, but I hope that answers your question. Karine is asking, what causes ferritin to be too low? Iron deficiency. That's the big thing, is that iron deficiency causes ferritin to be depleted. Let's see, Michelle. I like your middle name, Michelle. It's an awesome middle name. Michelle's middle name, by the way, for those of you who don't see it, is Osborne, and it's even spelled the same way. Is it unusual to have multiple autoimmune? I have SLE and celiac. No, as a matter of fact, the average person with one autoimmune disease, when you fast forward their life and the progression over their life, the average person is going to develop up to 6 autoimmune conditions, actually up to 7 autoimmune conditions. So it's not uncommon to see multiple forms of autoimmunity develop with time. What vitamins should we take if we have celiac disease to prevent a fatty liver? That's a great question, Julie. And the answer is, it's not the same for everyone. Different people have different deficiencies It just like gluten can cause damage to the stomach, but it can cause damage to the small intestine. For some people, the damage is here. For some, it's here. For some, it's other places. And so that's going to have an influence on that person's nutritional status, as is their diet, as is their sleep and their sun exposure and their stress levels. So there's so many multiple variables related around what supplements to take to protect your liver. Some people will say take milk thistle. Some people will say take N-acetylcysteine because they're liver protective. I'm not a big fan of those things just because, right? I'm a fan of taking what the body needs, and then when the body has what it needs, it can heal and repair itself. Again, that's the origin, right? So when it comes to just supporting your liver, if you're looking for just something to take that would be supportive and maybe you don't have liver damage and you're just trying to be preventative, the number one best thing that you can do is get on a high quality multivitamin, completely grain-free, gluten-free, multivitamin mineral formulation. We have something at Gluten Free Society called Ultra Nutrients, and we have another one called Multi-Nutrients, and either one of those are great products just from a preventative nutrition standpoint, how to keep your body getting adequate B vitamins, getting adequate minerals on a daily basis without overdoing it. Now, secondary to that, and again, that's pretty generic, is to get tested. Ask your doctor to run nutritional deficiency testing on you so that you can handpick what it is you actually need versus what it is that we might speculate could be helpful for you. Okay. Shelly says, I have fibro and feel much better off gluten. Yeah, I can second that from lots of people's experience. Thanks for sharing that with us, Shelly. Let's see here. You know, I think what happens is this feed doesn't show me all the questions because there were a bunch of questions that I think I passed over. Let's see here. All right, let's see. So just give me a minute, folks. I'm pulling up a different feed to see if I can get to the rest of those questions. So Tracy is actually talking about her white blood cells not rising, and that has a lot to do, oftentimes that has a lot to do with when white counts are not coming up. It either has to do with chronic immune exposure, and Tracy, because I believe, if I'm correct, I think you're from NOLA, and what I see a lot with people from New Orleans and the general Louisiana area, the Gulf Coast area, is mold toxicity because of the hurricanes and the home flooding. And so having mold toxicity in your environment, mycotoxins and other things, can actually suppress the immune system. They can suppress the bone marrow's production of white counts. So that might be an area that you want to investigate, Tracy, is ask your doctors to run mycotoxin testing and see whether or not that's playing a role in it. The other thing that we commonly see with anemias like that, where if you have white blood cell counts that are too low, red blood cell counts that are too low, is vitamin B12 and folate deficiencies notorious for creating that type of anemia, because those two B vitamins are necessary to stimulate the bone marrow to produce white blood cells and red blood cells. So, good question. All right. So Connie, here, I knew there was a bunch of questions that I missed. What if you had your very distal stomach removed along with the pylorus? Will it cause nutritional deficiency? It can. It's not that it's necessarily going to cause. It just predisposes you to additional nutritional deficiency. Remember, when you reduce the stomach area, the stomach only has so much area. And what does the stomach do? The stomach secretes acid. It secretes intrinsic factor. It secretes something called pepsin, which helps you to break down and digest proteins. And so if you have less of all of those chemicals going on, it can increase your risk for developing nutrient deficiencies of the nutrients that require acid in order to be properly absorbed. Now, the other thing that can do is increase your risk of infection. If you're actually underproducing stomach acid because of loss of stomach area, that you can be predisposed. When you eat normal things in the food, you're going to be exposed to bacteria and to other things, and some of those bacteria are not healthy, they're not good, but you have enough stomach acid to kill them. But when you reduce your stomach acid secretion, so those of you maybe are taking like acid reducing medications like Pepcid and Tums and Rolaids and Prilosec and Nexium and what's the other one? Brain fart, I'll skip it. But those of you who are taking those medications that reduce stomach acid, or you've had a surgery that reduces your stomach acid production by reducing your stomach area, surface area, you can increase your risk of developing infection. So, you know, that again, you want to keep your immune system strong. Okay. Okay, so Cody this is just another follow-up, and I think it's important to answer this question for many of you who may be having this idea. This is the same, Cody's the same person who was asking earlier whether or not you outgrow gluten sensitivity, and this is why I think that this question is being asked, is because, and Cody, I don't see a picture of you, so if I don't know if you're a boy or a girl, because Cody can go either way that way. So if I'm going to say that you're a boy, but if I'm wrong, I apologize. So Cody is saying, I didn't eat gluten for 15 years, but I have for the past 3 months, and then cheated my diet, and I have felt nothing wrong. Could you be less sensitive or not? No, it's not that you're less sensitive. If you're sensitive, you're sensitive. It's like, can you be less pregnant or more pregnant? You either are or you're not. If you're gluten sensitive, your immune system is having an inflammatory response when you expose it to gluten. Now, you had 15 years of avoiding it, so your body was probably capable of healing and repairing. So your resilience level is a lot higher maybe than what it used to be, but it doesn't mean that you're less sensitive to it. Gluten can cause damage in a celiac at 20 parts per million. That's a very, very small amount. That's one breadcrumb can create an inflammatory response for as long as 2 months. At least that's what the science shows on the topic. So I don't recommend, even if you didn't feel bad when you introduced it back in, I don't recommend putting it back in on a regular basis. Okay, oh man, we're way over time here. That's okay. So folks, if I didn't get to your question, you can blame the feed because it wasn't feeding me the questions in a timely manner. There were just so many coming at us. But again, I want to thank you all for attending. We're going to be back here next Monday evening for another episode of Pick Dr. Osborne's Brain. If you've got questions or you've got topics that you'd like to see me cover on future episodes, go ahead and send us an email at glutenology@gmail.com. And if you want more information, more of the information like what you're receiving here tonight, you can go over to glutenfreesociety.org and you can subscribe. When you subscribe, you can pick up our free gluten-free survival kit. We'll send it right to your inbox. No charge to you. It's just tons of information to help you on your journey going on the true gluten-free lifestyle. And those of you who don't know, if you can't make these live events, you can view all of our archives on our YouTube channel. So make sure you subscribe there. It's youtube.com/glutenology. And make sure you subscribe to our feed there where you'll get more information and all of our archive shows. We've got hundreds of archive shows that may already answer a number of the questions that you may be thinking that you have, but we may have already answered them. So the other thing, remember, don't forget, guys, gals, please, please, please help me share this information. We're trying to reach 100 million people. That's really hard to do without help, without creating a movement, without creating a big wave. So I need you to help me create that big wave. If you know somebody tonight who struggles with a gallbladder issue or a liver problem, make sure you forward this information to them. Make sure you're sharing this information with them to get together. We can save more lives, help more people. We will see you next Monday for another episode of Pick Dr. Osborne's Brain. Have a great week.
I was experiencing swelling in my ankles, in my hands, in my face, shortness of breath, extreme fatigue, and I needed to seek medical attention, find out what was going on. I felt hopeless. I went to just my general practitioner and found out that I had autoimmune hepatitis. and I was told that the only treatment was steroids and immunosuppressants pretty much for the rest of my life. I would never recover from this. At that time, I just felt hopeless. I didn't know what to do. I didn't want to be on medication the rest of my life. So I started to research and try to find another way to heal myself. I asked people, I searched online, and my sister was able to give me the name of Dr. Peter Osborne. When I came to see Dr. Osborne, I was hopeless. I wasn't sure that this was going to work. I had a lot of naysayers that felt that I needed to take the prescription medication. My first meeting with him, I was skeptical. He told me the testing that he wanted to do, and I wasn't really sure this could help me, but I went ahead and decided to do it. The people here made me feel reassured that other people had been here like me and that he was able to help them. So I decided to go down this path. I felt like it was the right thing to do. I felt like this was the only way I wasn't going to have to take the medication for the rest of my life. So I put my heart into it, and Dr. Osborne talks about a lot of it's your mindset and believing that you can get better. And I decided then and there that I believed I could get better. He was able to put me on the path of what kind of diet I needed to be on, give me supplements for nutrition deficiencies that I had. I want to say it wasn't easy. It's definitely a commitment, but he was there for me all along the way. I felt like he was doing what a doctor should. He even drew out diagrams for me of what was happening inside my body and why I needed to follow this specific diet, why I needed to take these supplements. It wasn't like a doctor just writing me a prescription. It's very personalized. They're looking at what your specific needs are, what specifically is going on in your body. At other doctors, you're just one of thousands, and here you feel like you're an individual. It took me about 18 months to be what they are calling remission from autoimmune hepatitis, which is a huge win since I was told that I would have this the rest of my life. I had brain fog, now I have clarity in my job. I feel like I can take on things that before I wouldn't because I was just tired and run down. I feel awesome. I feel like I have a new life.